So I'm ready whenever you are. Hi, good evening, everybody. Welcome to the annual general meeting for Southend CCG and Castle Point and Rockford CCG. My name is Dr. Jose Garcia. I'm Southend CCG chair. I think that we have few apologies today for absence. Haley, do you have the names?
Yep, we have Taz Saeed, Sami Oztag, and Mahesh Kamdar. Thank
you very much. The meeting today is virtual, following the government recommendations about meetings in public. We have some questions that the public has, members of the public has sent to us, but also during the meeting we have the question and answer facility available for people to make questions. The aim will be trying to answer them today. If for any reason we run out of the time and we cannot answer all of them, then we will make sure that that we do at a later stage. If we can go for the next slide, please. Yes, in this slide we have the name of the picture of the people who is going to present in this annual general meeting. That have to say that is special. It's special for two reasons, and I hope that you can sense that during the meeting. One of the reasons why it's special is for the year that it covers. Last year that we had the COVID pandemic. I still suffered it, but really bad last year. So all the things that we are going to present will relate somehow with that, and also is the last annual general meeting of the CCG, and we are going to have an agenda that we are going to go through. We will initiate the session with accountable officers report, and then we will discuss all the bits and pieces that the members of the committee will present right immediately after this one, with remarks of the successes and challenges that we have had. We will discuss some plans for our local place, and then we will review the reports and account in terms of performance, quality, finance, and an update on the work that we do with people and community, and we will end with questions from the public. So now I hand over to Tricia, who will do the accountable officer report on behalf of Anthony McKeever. To you, Tricia.
Thank you. Thank you very much, Dr. Garcia. As you say, I'm going to be presenting the accountable officer's report on behalf of Mr. Matt McKeever, who is the executive lead for the ICS. To introduce myself, my name's Tricia Dorsey. I'm the NHS Alliance Director for the 2 CCGs in South East Essex, and I also lead on children and young people for Mid and South Essex, and I'm the Deputy Lead for Learning Disabilities across Essex. For the Accountable Officer's report, we're going to focus on 3 key areas: the COVID-19 update and vaccination progress, the reset and catch up, and the way we're moving forward towards the new status as a statutory organisation as an integrated care system. And I just have to echo Dr. Garcia's comments that this annual general meeting will focus on a year that none of us were expecting, a COVID pandemic, a worldwide pandemic. And when I was asked to lead the organisation, I never knew that it was going to be through such turbulent times that has had such an impact on our system, on our local area, and on the people and the workforce that reside within South East Essex. Next slide, please. So if we look back over 2021, we've pulled together some statistics to give an idea, a flavour of the level of activity within Mid and South Essex and within South East Essex. You can see here on this slide a number of figures, but I'd like to just focus on a few of those just to give a little bit more granular detail. So during the worst of the COVID pandemic, people did not attend A&E, but over recent months, we've seen a significant number of people coming through the A&Es at Broomfield, Southend and Basildon Hospital. And we've seen a high number of people presenting with minor injuries. We'd like to thank the staff at the hospital who have coped with the challenges of COVID, but also with the high numbers of people that have been attending the department. We would still encourage people, if they have a minor ailment or condition, that they seek alternative treatment, perhaps through their local pharmacist. But just to give you an idea of the volume of people that have been treated within our system. Our primary care has been under extreme challenge during COVID. They've had to work in a very different way. And what we know at this time is that the number of people that are approaching primary care is much greater than it has been at any other time in our history. Primary care has had to work in a very different way, having to move very quickly from face-to-face consultations to using technology to be able to consult with people that need the help and support of primary care. We're in that period of reset, and now we're up to 58% of consultations being delivered at face-to-face. Saying that, we know that our new normal will mean that the benefits of using technology will be carried forward. We know that many people, working age adults in particular, really value the opportunity to speak to their GPs via telephone and having virtual consultations. But we know that people during COVID stayed at home with conditions, saved up their conditions. And now what we're seeing is high numbers of people approaching primary care as the gatekeepers for our health services to engage with care in a very different way. With regards to talking therapy, we know that the challenges of the COVID pandemic, the lockdowns, have created a huge amount of challenge for people's mental health and well-being. And what we're seeing is a high number of individuals engaging with our talking therapies to help them through mild depression, anxiety that has been created by the recent situations that we've had. And finally, I'd like to pick up on the number of people that have accessed learning disability health checks in our system. We know we've got more work to do, and we would encourage people with learning disabilities to engage in this programme, where they can have both assessments of their mental well-being, but also physical health assessments, because that we know that people who have a learning disability diagnosis are much more likely to suffer with conditions such as cardiovascular disease and diabetes. And the benefits of having an annual health check means that they will be able to be diagnosed at an earlier stage where there is much less risk of complications developing over time. Thank you. If we go to the next slide. So one of the big successes that we've seen in 2021 is the ability to integrate physical and mental health services more closely. So not only have we been focusing on those with learning disabilities, but we've also been focusing on the importance of health checks for local people who have a serious mental illness and historically may not have engaged with primary care for regular checks. We know that many people with serious mental illness may be receiving medication that puts them at greater risk of developing conditions such as diabetes and cardiovascular disease. And our team within the CCG have done incredible work at ensuring that we have an extremely high uptake of these health checks. And by doing this, we've been able to improve the outcomes for people with serious mental illness and also prevent some very significant complications for those individuals. And I'm very proud to say that both Southend and Castle Point and Rochford are in the top 3 areas in the country, making sure that these checks are available to people. But most importantly, it's important that we give access for these checks. But what we've heard from people that have had these checks is the benefits that they've had and how they feel that it has really improved their lived experience. So again, I would encourage people that are called for one of these health checks that they step forward and engage with the team to make sure that it can be undertaken. Next slide, please. Another success has been the work that has been undertaken through an integrated approach to support the homeless community in Southend. We had a pilot initiative that was launched by Southend PCN under the leadership of Dr. Haroon Siddiqui. But this just wasn't about primary care. This was about using the strengths of all of our partners in social care, in the voluntary sector, in the mental health provider, to ensure that individuals that are so often forgotten by our system were able to receive health support, also support around housing issues and their general well-being. I'm really pleased to say that this afternoon, Dr. Siddiqui and his team have presented as finalists in the HSJ Awards, and I'm really hopeful that they might be selected as the winner. The reason why I would be really pleased if that were to happen would be, one, it would recognise the fantastic work that they've done, but also it gives us the opportunity to share the learning from this project widely and maybe see it taken up in other areas within our nation. Even if they don't win the award, I'm not too bothered, because as far as I'm concerned, they're winners already in what they've done during 2021. Next slide, please. So as I said, and as Dr. Garcia has said, 2021 was the most challenging year because of the COVID-19 pandemic. What we saw was how all of our local services pulled together to ensure that there was the opportunity to support people in our communities. It was difficult, it was hard, and it remains hard as we reset. But what we've seen is the resilience of people within our population, but also the way that our frontline workers, whether that be in social care or health, have gone that extra mile. And at this point, I would really, really wish to compliment the work that has been delivered through our voluntary sector partners. Without our voluntary sector partners, we wouldn't have been able to deliver the COVID-19 vaccination programme as we have done so successfully. But it's been more than that. They have really stepped up and supported people who have been very isolated due to restrictions, and have been able to keep those people feeling that they've got support at the most difficult and challenging time. Now, as a result of the numbers of people that we had in Southeast Essex with COVID-19, our hospitals were extremely, extremely busy, and they stepped up and they supported people at the most difficult time. But that has created challenges in itself, as we know that we now have significant backlogs for planned elective surgery in our system. But I want people that are listening today to understand that we have plans in place to reset and ensure that people are able to receive the care that they need. But we absolutely acknowledge that there are waits at this time. And we just ask for people's patience during this very difficult period. Another great success was how we used technology. We had to work in a very different way. We had to work virtually. And we've used that and embraced it. And it has helped with the sharing of information, ensuring that prescriptions were available to individuals, and also all of the work that we've done around virtual consultations. big challenge, as I said earlier, has been the activity we're seeing in our GP services. Our GPs, our nurses, our emergency care practitioners, our pharmacists have all stepped forward and are working extremely hard at the moment. And we are now in a process of re-establishing more face-to-face consultations. Our COVID-19 vaccination delivery programme was a great success in that we were asked to ensure that people had the opportunity to access the vaccine back in January for those first priority groups. And we've continued to build on that programme of work with the support of EPUP, with the support of our primary care networks and the voluntary sector. And we have very high uptake figures across South East Essex. There's a few wards that aren't quite where they need to be, but we've responded to that challenge by ensuring that we have mobile vans now going out where individuals can access the vaccination. And indeed, our Vax van, as it's lovingly called, which has been recognised nationally as being one of the best ways of delivering the vaccine to hard-to-reach communities, has been a fantastic success and was led by one of our GPs in Castle Point and Rochford. I've already mentioned about the delays created by the pandemic, and we know that's incredibly difficult and frustrating for people. But it's expected in view of the way that we needed to focus all of our services on dealing with the COVID-19 challenges. We know that individuals have all been impacted upon because of COVID-19. We've been living in different times with high levels of restriction and social isolation, which has been extremely challenging for people's physical and mental well-being. Those challenges persist, so we will see plans within 21 and 22 to help and support our local population. But I just want to thank everybody within our system who stepped up to meet the challenges that we've had in the last year and done it in such a splendid way. And I want to thank the local population as well for really hearing and living in a way that helped to diminish the spread of COVID-19 in our communities. Next slide, please. So our performance is certainly not where it needs to be. Our performance has deteriorated in the last year as we've had to focus on the challenges that I've already mentioned. But what you can see in all of the areas on this slide where we are measured against national performance metrics, that we know where the issues are and we've got plans in place to improve the situation over the next 6 months to a year. There's a huge amount of work going on in the background to make sure that we can improve all of these different areas. But we recognise the fact that this is incredibly challenging as we emerge from the COVID-19 pandemic. And we would just ask for patience around these areas. Next slide, please. Alongside all of the work that we've done to support COVID-19 and to keep people safe, we've also had to start to plan for some statutory changes that will come to fruition in March next year. So the CCGs will no longer be the statutory bodies for health in our system. It will be replaced by an integrated care system where partners will come together in local areas to deliver services in a different way. For our area in South East Essex, we're quite complicated because we've chosen to straddle both Southend and Castle Point and Rochford. So this means that not only have we NHS partners, but we are working with Southend on Sea Council, Essex County Council, and the 2 districts in Rochford and Castle Point. We're working with 2 health watches, Essex and Southend, and 3 voluntary sectors of SAVs, CAVs and RAVs. We also have support from our hospice colleagues and from the police. We're working on priorities at the moment that will meet the needs of our local population. So our initial priorities are focusing on health inequalities. We want to work as a system to reduce avoidable readmissions into hospital. We want to improve mental health services, and we have plans afoot at the moment to do that. And we want to work with our colleagues in general practice to ensure that we have more supportive roles, such as the physiotherapists, the care coordinators, the social prescribers, the advanced nurse practitioners, the emergency care practitioners, and the pharmacists, so that we can ensure within primary care that people are accessing the right care from the right professional. If I've got back pain, which I may have at the moment, do I want to see a GP, or would it be better for me to see a physio? Absolutely, it would be better to see a physio. So by providing physiotherapy expertise into primary care, we can start to ensure that rather than move through a number of professionals, that you see the right professional at the right time for the problem that you're presenting with. So the next steps for our PLACE plan as we move towards the Alliance and the new statutory organisation in March next year is to agree a multi-agency Alliance PLACE plan. And we're well on the way to achieving that. Next slide, please. I wanted to talk about children and young people today, and Mac was keen that I did, because children and young people is now one of the 3 priorities for our integrated care system for the future. Our 3 priorities are stewardship, workforce, and children and young people. And on this slide, you can see the work streams that we have created in the last year, which means that we'll be able to prioritise the focus and develop services to ensure that our children and young people get the best start in life that they can. But this will only be as a result of collaborative working with education, with health, and with our colleagues in the local authorities. But as you can see, it's quite challenging what we've set ourselves as areas that we want to improve in. But I'm really pleased to say that for all of these areas, we're starting to see green shoots and improvements happening, which is coming back to us through a variety of different areas and feedback from people within our system. I'm now going to hand over to Stephen Mayo, who will talk us through quality performance. Thank you, Stephen.
Thank you, Tricia. So my name is Stephen Mayo. I'm the Interim Director of Nursing for Patient Experience. I'm going to talk about quality performance throughout the period of 2021. So I've just got one slide, and I'm going to give you some high-level details and information around each of these boxes and just some headlines. I think before we start, I have to say I've been a nurse since 1986, and we've had many challenges. I've had many challenges and seen many things since 1986. But actually, COVID, I have never seen the demands and the challenges in all my nursing experience as the last year 2021 has brought for all of us. That's for everybody: clinical, non-clinical staff, NHS staff, non-NHS staff, and the way the systems and our local system has come together during this period and has risen to the challenge has been absolutely phenomenal. And I just want to say a big thank you to all the staff that were involved. And I also think if we move to quality and transformation, I think because of these challenges that we've had through 2021, it's been even more important to focus and support our patients, their families, and our staff, and to really champion those equalities and to try and reduce the variation of our health inequalities throughout this period, particularly in the backdrop that during this time period we have had COVID, as I've said, but we are also moving towards that transition towards an integrated care system. And a couple of examples of how we've been transforming services because of that and in response to COVID. is within our continuing healthcare teams and also within our mental health commissioning teams and our staff. And we are looking forward to take some of the learning, as Tricia has said, some of like the digital innovation, etc., and to take that forward and how we can embed and sustain that in 2022 and going forward. In terms of infection prevention and control, I think, as you would expect, because of COVID, IPC measures have been at the forefront and really on the front line of all COVID, because COVID really has been the only game in town during 2021 and the single focus, particularly of the IPC teams. Locally, to champion IPC and with a special focus on care homes, I think we have built on really good existing relationships and collaboration, but we really have come together very quickly in partnership and collaboration and strengthened those relationships, particularly with health, our local authority colleagues and public health. And a real good example is how the local care home hubs came together and really worked to support our local care homes, providing them with real-time advice on guidance on things such as PPE and the latest COVID regulations, because they changed quite rapidly throughout 2021, and having that single contact and go-to point to keep things current and fresh and that the care homes could contact was really vital. We've also, to support that process, we've also, for Southend, we secured funding to support a care home IPC nurse, and that has really paid dividends as well throughout COVID. So I think that the IPC teams and the responses to our local demands and issues and challenges has been quite inspirational during 2021. Other teams that I would like to draw focus to is our continuing CHC, continuing healthcare team, and they too were significantly affected through 2021. Staff were redeployed. That left a reduced staff in our CCG teams to manage the CHC referrals, etc. But they also had to work very, very differently. So, for instance, because of the isolation and the fact that we couldn't have face-to-face contacts anymore, we had to set up a series of welfare calls and contact points with our patients, and that worked really well, particularly through the isolation, particularly because these prevented issues and problems from escalating and potentially resulting in a hospital admission. And that regular contact with our patients, our healthcare patients, was absolutely vital through COVID, and those early interventions were really critical to avoiding some really hospital admissions, and the last place you wanted to be in COVID was in the hospital. We've also been helping the back end of the hospitals with the D2A, the discharge to assess process, and supporting the flows out of the hospital. And actually that initiative we're going to take forward and strengthen going forward into 21-22, because it really did work well. The work in CHC is not over yet. As Tricia mentioned, we are returning to some sort of BAU. We do have backlogs, but we are working on that. We have robust plans in place to address all that, and I'm quite confident we'll be able to resolve all this backlogs by the end of the year. In terms of quality and patient safety, I think it was very early throughout COVID recognised that we needed to protect our safeguarding functions. So we made a deliberate and conscious effort to ring fence and support and protect our safeguarding functions within the CHCs. So unlike the CCGs, so unlike the CHC teams where some members of staff were redeployed, we did not do that with our safeguarding teams. And actually that has paid off dividends, because, you know, in terms of safeguarding referrals and issues like domestic violence because of the social isolation, that was a really important function to keep and to protect within our CCG locality. Moving on in terms of patient experience, we have been in 2021 and continue to do so going forward, develop a nursing and patient strategy, particularly in response to going forward to the new ICS. We have also been working on some ICS transition workshops, and we've had several workshops around both. And one of the strong messages that have come out of both of these lines of work are we do co-production and patient involvement well, but we need to strengthen that and to champion that going forward. And I'm really excited about that and taking that forward and developing a co-production strategy, etc., for our new emerging ICS. We have also been taking a series of patient stories, video vignettes to our patient boards, a joint committee, our local CCG boards, etc., and also sharing with our providers. And we've reinvigorated that process, and they've been really powerful, and we've seen some tangible changes coming out. That an example of that would be around cancer and the fact that the IT and the new digital innovations. Do patients really have to travel to London to see an outpatient appointment? We need to embrace that and to really tailor that to our patients' needs and improve their expectations. So I just want to leave you with some thoughts around regulation before I hand over to Lee or Mark Barker, in terms of where we are with our CQC ratings for our providers, etc. So across the southeast, we have 45 out of 48 of our GP practices rated good. We have, for our care homes, we have 80 out of 107 care homes as rated good. For our community provider and our mental health provider, the CQC rate them good. Unfortunately for our hospital group, Mid and South Essex Hospital Group, and for East, they do have requires improvement. But I need it to be noted that we are working really close with these two providers, and within that range of requires improvement and with investment, etc., we are already seeing some green shoots of recovery in that, and we will await their revisit by the CQC. So what I'm trying to describe is that in spite of a very challenging year, in spite of all the COVID issues, and in spite of all the changes in our local healthcare system, we still do deliver a good service, and that is underpinned by what we find in our regulation. Mark, can I hand over to you now, please?
Absolutely. Thank you, Stephen. Good afternoon, everybody. Thank you for joining the AGM. Stephen, Tricia, Jose have already given some significant outline to our challenges that we've faced over the past year. For the record, I'm Mark Barker. I'm the Chief Finance Officer for the Southend and CPR CCGs, and I'd like to take you through some headlines in terms of how we have performed financially over the year ending 31st of March 2021. The slide that you have before you gives us some indication that we've maintained our finances in a robust and structured manner. We have achieved all of our statutory and locally agreed financial targets within both CCGs. This has not been without challenge, and our delivery for the year has been somewhat tested by the pandemic that we've had to manage our way through and support significantly with finances from Treasury and from our existing allocations. However, we have achieved a delivery of an in-year break-even position. Our cash targets have been met, so we have drawn down exactly the amount of cash that we anticipated for the year as we work through the pandemic. And we've met our mental health investment standard targets, which is striving towards success and achievement in investing further in our mental health priorities. And to top it all, we have achieved clean external audit opinions for each of the CCGs, Southend and CPR. Back on to the next slide, please. This slide gives you an indication of how close and how bang on we have been in terms of our break-even duty. It's vital to ensure that we invest in our services and invest to the maximum allocation that we receive. And we have achieved that without any variation, which gives us a very good and opportune moment to actually invest fully our allocation in mental health care and continuing healthcare and acute care services, as well as primary continuing healthcare and all of the other aspects that we focus upon. Our running cost allowance is relatively small. Within our total allocation, we only have 3.7 million allocated to overheads and support services, and we have not exceeded those targets for CPR or for Southend CCG, and again have made sure that we manage within our cash allocations. Our MHIS and our minimum cash drawdown has been contained within our allowances for each of the CCGs, and our audit opinions show a true and fair view for both. Next slide, please. This gives you an indication of where we have spent our monies within Southend CCG. Almost half, 45%, is spent on acute services, and then mental health, continuing healthcare and prescribing, each taking 10%. We have a lesser investment at present within our community services and primary care, but our focus as we become a CCG or an ICS for the future will be that we take away from secondary care to invest in localised services wherever practical and appropriate to do so. Next slide, please. Can I have the next slide, please? Thank you. Oh, one back. We skipped over Southend. Apologies. So for Southend CCG, very similar to Castle Point and Rochford, we've invested primarily into acute services as the pandemic has raged through the nation, and of course continue to invest well in mental health, continuing healthcare and prescribing. But our focus will be for the future to ensure that we invest more in a community and locality based service under the ICS of the future when that's set up from the 1st of April 2022. Next slide, please. And one more. And looking forward to 21-22, it's going to be a year, it has been a year of challenge. In line with the pandemic, the Treasury have advised and informed us of allocations for 2.5-year allocations. So it's a year of 2 halves. We've received allocations for the first 6 months already, and we've spent within that allocation to make sure that we can manage our services, support healthcare as we emerge from the pandemic, assuming that there's no further surges or breakouts in terms of further infection rates. And we're continuing to maintain a break-even position for both CCGs. As of month 5, our financial position is on plan for both, and our allocations for the second half of the year have been received as of yesterday. And as a consequence, we're currently working through that to see how we can invest for the future and recover the backlog of waits, elective activity, and of course make sure that we address the build-up of healthcare needs, which has happened over the last 18 months, which has been, to a certain extent, had to be put on hold as we manage the pandemic and that faced us. Our plans are due to be submitted for NHS England for approval and a sign-off probably late in October, given that we've only just received our half-2 allocation. But that said, we are well placed for managing our finances for 21-22, and we will continue to make sure that we invest fully in the healthcare services and needs of our patients and population. I'm now going to hand over to Janice Gibson, one of our lay members, to talk us through people.
Thank you, Mark. If we go to the first slide, please. So I'd like to introduce myself. As Mark said, I'm Janice Gibson. I'm a lay member, and I have patient and public involvement responsibility for both Southend and Castle Point and Rochford CCGs. A lot has been actually said by the previous speakers, which I totally endorse, about the year that we're actually discussing in terms of, you know, unprecedented times, etc. But I'd like just to add to that conversation and these points in the hope that it further endorses but also highlights some other points of consideration. So every resident, 1.2 million, has the right under the NHS Constitution to be involved in healthcare plans. And I'm pleased to report that despite change and challenges, the CCGs continue committed to ensuring that people have their say. This has been and will continue to be an imperative as the 5 Mid and South Essex CCGs come together in an integrated care partnership, or ICS, and purchase and monitor the NHS services that will be provided in our area. Services have changed very rapidly in 2020 to respond to the COVID pandemic. There has been comment about how everyone responded. We saw GP surgeries having to change their structures, online appointments featuring strongly, and other services were aligned to deal with and address the unprecedented circumstances that the health arena found itself having to deal with. What I would also add to that is, and it's been touched on sort of in this conversation, is that the ability for people to come together, you know, the clinicians, the professionals, the different sectors, the agility was outstanding. And within days of, you know, the pandemic hitting our shores, it was all systems go. So absolutely, you know, to witness that was absolutely incredible. Some of those changes will continue because there's been some valuable learning, and the NHS is set to have new structures that will take that forward. Giving the communities we serve a chance to help shape the future of the local NHS is the right thing to do. And it's important that we have a clear picture of what matters to our residents and local people. We will continue to be involved with them. We will continue to encourage people to be involved. And I would like to thank all of those that in the most difficult year that took the time, took the trouble, were still able to participate. You know, it made a huge difference, and we hope that that will sort of long continue. The shaping of the services and the contribution that everyone made from the public arena was really, really important. So I think I've covered that one. So the next slide, please. The next slide will actually explain some of the things that were established and what were achieved. So we established governing body meetings in public, online, so that residents could put questions to our board members. It's important that decisions are transparent and people can question those decisions. As soon as the initial surge of COVID cases eased in the summer of 2020, and I think we'll all remember, you know, that huge commitment to sort of getting through to that point, we arranged that our governing body meetings be live streamed via technology so that people could stay in touch. That meant that, you know, thousands of people were kept in touch with. I think it's also important to say, and it demonstrates the care that the CCGs took, that some people can't actually access technology, but are very, very interested in the healthcare sector, what that means for them. And where those people made it known that they were interested in information, the CCGs actually supported them. And I think that is a very important factor as well. We brought residents into non-emergency patient transport planning so they could share their views and experiences, and also asked about flu vaccinations to build the winter 2021-22 plans. That was all taking place whilst dealing with the pandemic and all the emergency situations that were ongoing. Next slide, please. So just looking at that NHS Castle Point and Rochester and NHS CCGs engagement work rated as green, that is an absolutely huge achievement if you look at how the ratings were increased, and well, from 5 to 13 over the last 3 years. Absolutely magnificent performance. And as layperson, in terms of that engagement, I'm very proud to be able to support the work that has been done by the teams in those 2 CCGs. Strengthening the partnership work and to reach deeper into our communities. This has already been mentioned several times. And it's been a really significant step forward. The harnessing the value of the partnerships with the voluntary, community and local authorities has been unprecedented. People worked together prior to the pandemic, but actually, you know, the way they've worked through this time in an integrated manner with the care and support to each other, ultimately all for our residents, for our patients, has been truly sort of wonderful. That's helped us reach out to seldom asked groups, and we've also listened to what matters to these people. Yeah, sorry, I'm just looking at my notes here. I think it was touched on earlier, but in terms of this partnership working, you know, the reach has actually been astonishing. We are talking about hundreds of thousands of people because of this partnership working. And we've recognised that, or it's been recognised, and Tricia has spoken about, you know, the formation of the alliance, the importance of the partnerships, who's involved in that. It's actually reinforced something that is really, really new, very, very exciting. And actually where what we've learned, what we've gained will actually continue in the future. So for me, that's integral for the planning and also the support that the residents will have. Next slide, please. So this basically outlines, you know, what you told us and what we did about it. I'm not going to go through the various slides, boxes, but you will see it was taking the views of people to create different opportunities of thinking about services in a different way, thinking about the future, bringing in community groups, flu vaccinations, care staff. It really, the learning disability programme has been mentioned. And I think what I would like to add to this, and it was sort of probably prompted by what has been said by colleagues previously, is if we've got the acute trust, we've got the primary care settings, social cares, etc., all the partners. But what I would say about primary care is they have been under huge pressure, really, really significant pressure. But during that period that we're talking about, they continued, you know, to not only support their patients directly, but actually use the other partners to reach out to make sure that those people that they knew were clinically extremely vulnerable, their patients, were contacted regularly, that the people with learning disability, the health checks were contacted. They are also both independent people and also care for people, so that was their carers. And that didn't happen as a one-off. It went on throughout the year. And I actually applaud, you know, the primary care networks, all the professionals that have actually worked to make that happen, because it was true caring in the sort of most significant way. I think that actually finished my presentation. I'd like to hand you back to Dr. Garcia, please.
Thank you everybody for a very good, nice and a presentation that was coming from the heart. And so thank you everybody. I think now it's time to answer some of the questions that we have had in advance. Tricia, I think that you were going to bring them up.
Thank you, Jose. So with your agreement, what I'm intending to do is to read the questions as they've been submitted and then provide a response.
Yes,
We've
please.
had 3 questions, one from Councillor Ian Foster, one from Councillor Angelina Marriott, and one from Councillor Adrian Eves. So the first question from Councillor Ian Foster is, the Rochford District Council is holding £427,635.76 for use by the NHS for capital works. This was provided as a healthcare contribution by the developers of the Hall Road housing development in Rochford. I am aware that the Jones family practice is seeking to expand since they have insufficient space for the number of doctors they require, and the current surgery cannot be expanded. Is the practice aware of this funding? Have other plans been made for the money? Secondly, I am aware that £28,382 is held by RDC, having been provided by the developer at Bullwood Hall to provide addition or improvement of facilities at the Churchview surgery, which is part of the same group as Jones family practice. I believe they are unaware of this. Have plans been made for this money? Thank you, Councillor. So the response we'd like to give is, we are aware of the funding secured from Section 106 funding streams within the council area. We have started to have conversations with the GP practices about increasing capacity and how this may be achieved prior to the COVID outbreak. Excuse me. We have recently employed a PCN Estates Programme Manager to work with each PCN in developing an estates plan. As part of the plan discussions, we will work through these with practices and their associated PCNs in a bid to support delivery of additional capacity as quickly as possible. Thank you. Now, the next 2 questions have close links, so I'm going to read both and then our response. So from Councillor Angelina Marriott, I would like to ask about Section 106 money going where it was intended. I am a local councillor. My local surgery, the Riverside Medical Centre, has not been extended to accommodate extra patients joining due to a new housing estate. What steps are being taken to ensure that Section 106 money gets spent where it is intended in accordance with planning permission, and that patients do not end up suffering from stretched services? And then the question from Councillor Adrian Eves. The CCG has either received or is due to receive substantial funds from Section 106 agreements arising from various large housing projects in the Rochford district. These funds are collected with the intent that they improve the services the NHS provide in the immediate area of the housing developments. Can the CCG explain in detail what has been done with those sums to improve the NHS service in those immediate areas? So I have more detail, which I'm more than happy to supply to the councillors outside of the meeting, but this is the response that I'd like to give. The primary care team are arranging meetings with practices to clarify their plans. We are now meeting with all PCNs to develop estate plans. They will be provided with detail of development growth and funding that is available, including Section 106 monies, to deliver their plans, and will be supported in this work by the estates team. Note, please, that not all the 106 monies that have been secured are as of yet available. Thank you. I hope that that's a sufficient response to our 3 councillors, but I'll hand back to you now, Dr. Garcia.
Thank you, Tricia, and thank you for your answers. Do you have any final slide? Well, now it's for me to close the general meeting, and I would like to say that our job as a commissioning organization is very simple. It's commissioning health services for the people that we serve. even if it's very simple, it's really very complex work. And in this work, there is two key elements of that. Is the people who provide and work to commissioning the services, and the people who receive the services. So what I would like to do is give thanks to people, and I would like to thank three groups of people here. Personally, I would like to thank every and single one of the people who work or have worked for these amazing organizations, Southend CCG and Castle Point and Redford CCG, because they have given everything that they could and more to keep the system working, and always patient has been in the heart of what organizations they do. Also, on behalf not myself, but also on behalf of this organization, I would like to thank the people who provide those services. They have been described as heroes, and I'm not be the one to challenge that. But what is clear and no doubt is that generosity, compassion, professionality, and dedication are remarkable and evident. As someone reminded me yesterday, people are the best assets of the NHS. And of course, I don't want to finish without thanking more people, the people we serve. Last year, I did a video around the time when people were clapping from frontline clinicians, and then I was clapping for people, because without the support, without the resilience, the understanding of the patients, wouldn't be here today. So we are forever grateful for the recognition and their appreciation also. So I would like to finish too, and I hope that people will forgive me. I'm going to break a little bit the rules of etiquette, because it's a very serious meeting, but also it's a time to celebrate. I would like to, and I will invite other people to do it like me. In the same way that I was clapping for people, I'm going to clap now and invite other people to do it for the people organization, people who deliver the service, and the people who receive the service. So, thank you. And with that, we finish the meeting. Thank you, everybody.